Hello everyone, you're watching Physio Classroom channel, and in today's video we are going to learn the manual therapy skill to deliver the 7-stage shoulder mobilization technique to decrease pain and improve range of motion in frozen shoulder or adhesive capsulitis patients. This technique helps in restoring the 3D or the three-dimensional mobility of the shoulder in both the frontal, sagittal as well as the transverse plane. This technique of performing the shoulder mobilization in 7 stages is also known as the Spencer's technique for shoulder joint. So let's get started with the practical demonstration of this technique. So to deliver the 7-stage mobilization technique for the shoulder joint, the therapist first makes the patient assume the side lying position in such a manner so that the side that needs to be treated remains towards the ceiling. Next, the therapist flexes the hip and knee of the patient so as to stabilize the spine and also to prevent any forward or backward rolling of the patient during the deliverance of the mobilization technique. Also, a pillow is kept under the head of the patient to maintain the head and neck in the midline position. So in the first stage, the therapist is going to try and utilize the oscillatory gliding technique and the muscle energy technique to improve the extension range at the shoulder joint. So for this, the corded hand of the therapist is going to grab around the posterior part of the elbow joint, and the cephalad hand of the therapist is going to stabilize the glenohumeral joint in such a manner so as to prevent any movement from taking place at the scapulothoracic articulation and the acromioclavicular articulation. So after holding and maintaining this position of both the cephalad and corded hand, the therapist is next going to utilize the left hand and take passively the shoulder into the end range of motion. The point where the therapist feels the restriction, the therapist is now going to deliver the oscillatory movements or glides in the end range of restriction. The intention here is to every time try and cross the restriction barrier and improve the range of motion at the glenohumeral joint. After performing this oscillatory movements for around half a minute, the therapist next starts doing the muscle energy technique for improving the further range of shoulder extension. Now for this, the therapist instructs the patient to push against my resistance and bring the shoulder into flexion. So now push and move it into flexion. Utilize your about 30% of force, 1001, 1002, 1003, 1004, 1005, and relax. Now as the patient relaxes, the therapist takes the shoulder into the newer range of extension movement. This procedure of pushing into the hand for around 3 to 5 seconds and again relaxing and taking the shoulder back into the newer range is repeated until there is no further improvement in the shoulder range taking place. So this is a very important tip that every physiotherapy student as well as young practitioners should keep in mind. Every time the patient is asked to produce the isometric or isotonic contraction from the tight group of muscles, like for example, okay, again push into my hand and take your shoulder into flexion, 1001, 1002, 1003, 1004, 1005, and relax. After relaxing, instead of taking the joint passively, always prefer to add resistance and ask the patient to actively try and take the shoulder into the new range of motion. This is not only going to improve the range of motion at the target joint, but is also going to improve the muscle control that is required to maintain that improved joint range. So this completes the stage 1 of the shoulder mobilization technique. Now for the stage 2 mobilization, the therapist is now going to try and improve the flexion range of the glenohumeral joint. So for this, instead of facing the patient, the therapist is now going to change the stance, and now the therapist is going to look towards the head end of the table. So the hold that was used by the therapist for the stage 1 is also going to be reversed now for the stage 2 mobilization. So this time the cephalad hand is going to be used for holding the patient's wrist, whereas the corded hand is going to wrap around from the posterior side just proximal to the glenohumeral joint. The intention again being to stabilize the scapulothoracic articulation and the acromioclavicular articulation. Now from here, the therapist maintaining a wide stance is going to take the shoulder into the end range of flexion movement. Now once this end range of flexion movement is achieved and the therapist feels that there is a restriction, then from here the gentle oscillatory glides will be performed for around half a minute or so. The intention again being to gently cross the restriction barrier and take the shoulder into the newer range of motion. Now again, after this, the therapist is going to utilize the post isometric contraction. Now again, I want you to push into my hand downwards 1001, 1002, 1003, 1004, 1005 and relax. And again, two options: either take the shoulder joint passively into the newer range or ask the patient to pull up and take your shoulder up. Very nice, very nice. Again, this technique is going to be repeated for around 5 to 7 times or until there is no further improvement in the shoulder flexion range taking place. Now for the stage 3 of shoulder mobilization, the intention of the therapist is now to improve the 3-dimensional mobility of the shoulder joint by inducing circumduction with slight compression movements. In this, again, the elbow of the patient is kept flexed and the hold of the therapist is again same as that of the stage 1. So the cephalad hand is going to wrap around just proximal to the glenohumeral joint and the quadrant hand is going to wrap around the elbow joint. Now from here, the patient's shoulder is abducted into the end range of restriction barrier. From here, the therapist next induces slight compression movement by pushing the humerus down towards the glenoid cavity, and while maintaining this slight or light compression, the therapist induces clockwise circumductory movements into the shoulder joint. Gradually, the arc of circumduction is made bigger and bigger so that larger circles of circumduction movements are produced by the therapist. Now this movement is continued for around half a minute or so, and then the therapist reverses the movement. That is, now anti-clockwise circumduction movements are produced for around half a minute, every time trying to make the circles bigger and bigger. Now for the stage 4 mobilization, the intention of the therapist again is to improve the 3-dimensional mobility of the shoulder joint, but this time the therapist is going to induce the traction movement with the clockwise and anti-clockwise circumductory movements. So in the stage 3 there was compression with circumduction, and for the stage 4 there is going to be traction with circumduction movement. So the hold is going to be like this. The cephalad hand is again going to stabilize the glenohumeral joint and the quadrant hand is going to hold the wrist of the patient. The patient's shoulder is going to be taken to the end range of restriction barrier, and from here the therapist is going to apply a vertical tractional force so that to separate the humeral head from the glenoid cavity. Now while this traction is maintained, the therapist is again going to induce small arc of circumductory movements. So first in the clockwise direction for around 30 seconds, every time trying to make the arc bigger and bigger. After this, the traction is maintained and the direction of the circumduction is changed. So the anti-clockwise movements will be performed for around half a minute. Also, the therapist can take help from an assistant to help with the traction movement while only focusing on the circumduction part. Now the stage 5 of shoulder mobilization technique is divided into 2 parts, namely the stage 5A and 5B. The stage 5A is intended to improve the ranges of shoulder abduction, whereas the stage 5B is intended to improve the range of shoulder adduction and external rotation movements. So to perform the stage 5A mobilization, the therapist is going to stand facing the patient and the cephalad hand is going to be placed just proximal to the glenohumeral joint. Now because the intention is to improve the abduction range and also not allow any rotational movement occur at the glenohumeral joint, so for this what the therapist can do is ask the patient to grab the forearm with the affected side hand. Now what this is going to do is, when the abduction is going to be performed, only pure abduction movement is going to take place without any rotational movements. Now from this starting position, the quadrant hand is again going to wrap around the elbow joint, and then the shoulder is going to be taken into the end range of restriction barrier. Again, same concept of treatment will be utilized. That is, in the end range, small grade oscillatory movements will be performed for around 30 seconds. Intention being every time to break the adhesions and cross the restriction barrier, improving the range of motion. After 30 seconds, utilize the MET. Ask the patient to push down against my hand. Utilize 30% of your force, 1001, 1002, 1003, 1004, 1005, and relax. Again, two options: taking the joint passively into the newer range, or much better is asking the patient to pull up against resistance and move the shoulder up. Again, perform this for around 5 to 7 repetitions or until no further improvement in the range is taking place. Now, to perform the stage 5B mobilization, the therapist first makes the patient flex the shoulder joint so that the elbow crosses the anterior chest wall. And now from here, the patient's hand is placed upon the cephalad forearm of the therapist. The cephalad hand again maintains the stabilization just proximal to the glenohumeral joint. And now from here, the therapist starts inducing the adduction movement in the shoulder joint. Now again, once the end range of restriction is met, the therapist starts inducing gentle oscillatory movements. Again, the intention is to gradually break adhesions and improve the range of adduction as well as the external rotation. Again, from here, utilize the MET. Ask the patient to pull up the shoulder, 1001, 1002, 1003, 1004, 1005, and relax. And again, now push down and try to bring your elbow closer to the couch. Great. So every time increasing the range of motion in this manner for around 5 to 7 repetitions. Now the stage 6 of shoulder mobilization technique is intended to improve the internal rotation range at the glenohumeral joint. Now the starting position will be such that first the therapist is going to abduct the glenohumeral joint to around 45 degrees and is going to try and place the dorsum of the patient's hand close to the back in this manner. So a lot of time we see, because of the restricted internal rotation movements in frozen shoulder cases, the patient is not able to take the hand towards the backside pocket. Now from this starting position, what the therapist is going to do is, while maintaining the cephalad hand with the same contact and keeping the corded hand over the elbow joint, the therapist is going to push the shoulder forward. So what it is going to do is, it is going to increase the internal rotation movement at the glenohumeral joint. Now once again the end range of restriction is met, the therapist is going to start with the oscillatory movements, every time trying to break the end range restriction and improve the range of motion. After performing these oscillatory glides for around 30 seconds, the therapist is next going to utilize the post-isometric relaxation technique. So for this, the therapist is now going to ask the patient to push back against my resistance and take the elbow back, 1001, 1002, 1003, 1004, 1005, and relax. And now again take your elbow forward against my resistance and the new range will be accomplished. So again, utilize this technique of pulling back 1001, 1002, 1003, 1004, 1005 and relax, and pushing forward and gaining the newer ranges of internal rotation, repeating the procedure for around 5 to 7 repetitions. Now the seventh and final stage of the shoulder mobilization is intended to further improve the joint play in the glenohumeral joint by improving the accessory movements. The technique of mobilization helps in further stretching and improving the elasticity of the tight ligaments and capsules of the glenohumeral joint. So to deliver this mobilization, the therapist keeps the patient's elbow straight and then abducts the patient's shoulder so that the patient's forearm and wrist rests on the therapist's shoulder in this manner. Now from here, the therapist interlaces both the fingers and wraps the hands around the shoulder joint just distal to the joint line of the glenohumeral joint. Now from here, the therapist delivers the inferior translatory movements in this manner, the intention being to scoop the humeral head inferiorly towards the lower portion of the glenoid cavity. Now please remember, it is the inferior part of the capsule which becomes tight, which is otherwise lexed, which allows the end range abduction and external rotation movements. So now the intention here is to again make the humeral head lie in the inferior part of the shoulder capsule so that we can have that increased ranges of shoulder abduction and external rotation movements, which are severely affected in the frozen shoulder patients. Now this inferior translatory movements in the scooping manner is performed for around half a minute, and after this the therapist utilizes the MET to further gain this inferior translation of the humeral head. So for this, while maintaining the inferior caudate traction, the therapist now asks the patient to push down on the resting shoulder, and the contraction is held for around 3 to 5 seconds, 1001, 1002, 1003, 1004, 1005, and relax. As the patient relaxes, the head is pushed more inferiorly towards the inferior part of the glenoid cavity. Again, this can be repeated for around 3 to 5 repetitions, and then the patient's ranges can be reassessed. So this was all about the practical demonstration of the 7-stage shoulder mobilization technique. I sincerely hope that the physiotherapy students and young practitioners are going to utilize this valuable information and are going to treat their patients utilizing this technique. Do provide us your valuable feedback of the outcome of therapy sessions. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.